All right, so I had the honor of doing my thesis with Dr. Ken Prager about a piece of legislation called PA Act 112. Anyway, this is a piece of legislation that concerns itself with how we report the results of medical imaging studies, and we think it may blur the boundaries between medicine and the rule of law. Yep. No, that's okay. So we'll discuss, how this might impact radiologists, ordering physicians, and patients. Thank you. So if you are a patient and you have some issue that needs a medical imaging study, if you're the patient, you go to the ordering physician, it could be your primary care provider, it could be your internist or orthopedist. They deem that you need this study. So you go, you get the imaging, whether it's an X-ray, a CT, something like that. A radiologist interprets the image and sends back his or her findings and any recommendations for follow-up to the ordering physician, who then guides the patient on further management. And this paradigm works because oftentimes the radiologist's findings are often filled with medical jargon that the patient might not understand, and it might not be helpful for them. But this paradigm often doesn't work because these ordering physicians oftentimes have hundreds or thousands of notifications, and one can slip through the cracks, and a patient might not get their need for follow-up reported to them in a timely manner. So this is a Representative Marguerite Quinn. She's from my district. I grew up with her kids, and she claims that two of her constituents suffered an untimely death because they didn't get the results of their imaging study reported to them quick enough, and that follow-up these tests would have given could have saved their lives. So in sort of a compromise between radiologists in the state of PA and legislators, they came up with Act 112. So this act now says that radiologists must directly notify patients of their need for follow-up of something that when a significant abnormality is found. So instead of radiologists referring back to the ordering physician and then telling the patient, radiologists legally now have to tell the patient directly when a significant abnormality is found. So what are we reporting about? Well, significant abnormalities are those that would cause a reasonably prudent person to seek follow-up within 3 months. And instead of getting that jargony radiology report, patients receive this standardized notification mailed to their door within 2 weeks. The notification reads, "You are receiving this notification as a result of a determination by your diagnostic imaging service that further discussion of your test results are warranted and would be beneficial to you. The completed results of your test or test have or will be sent to the healthcare provider that ordered the test, and it's recommended that you contact your healthcare practitioner to discuss your results as soon as possible." So no matter what your imaging study said, as long as that requires follow-up, you get this notification. So I don't know about you, but I wouldn't feel very good getting this notification. So did it work? Well, we don't know yet. The jury's still out. We're still collecting data, but maybe before we call this act a mistake, or before we say, it's a future roadmap to guide legislation in other states or across the country, we can examine this with a bioethical lens. So the implications for patients, it is really great to get patients directly involved with their care by directly communicating with radiologists. It does support autonomy. But the notification is sort of vague and confusing. It kind of hints that something's wrong. You have to imply that out of it. It doesn't tell you exactly what's wrong because that might make you upset, or you might not understand the medical jargon. So that needs some work. And it was found that the language of this notification is actually at a 12th grade reading level, but the CDC recommends that medical texts be around a 5th grade level so most people can understand them. So in a survey of this notification, only 60% of people understood what they meant or what they implied. And it was found that lower socioeconomic status, non-white race was associated with not understanding what this notification meant for your healthcare. For radiologists, they're very busy. They are tasked with every day interpreting and accurately and quickly interpreting hundreds of medical imaging, but now they have a new task to send these notifications out to patients. But I think the biggest issue for radiologists is the vague and arbitrary inclusion criteria. So, typically if a patient has, say, a 1 centimeter lung nodule, they should get follow-up at, 3 months versus a different size at a different month. It's all standard criteria, but now we're reporting to the standard of what a reasonably prudent person want to know in 3 months? Who is a reasonably prudent person, and why are we saying 3 months? And then the issue with disparities in care, because of this very subjective standard, a radiologist in one area may be telling people to get follow-up about something when patients in a different area don't get those notifications. And then another thing for the medical legal system, so radiologists can typically protect themselves against malpractice claims by following the standard evidence-proven guidelines. But now that things are very subjective, maybe radiologists will start overcalling things as significant when they're actually not, to get that patient the notification so they maybe won't get sued. But that might result in a lot of unnecessary follow-up for patients. It's great to get patients involved in their healthcare early, supports value-based care, early detection of disease to save money, but there is a potential for, a lot of unnecessary follow-up care, waste in the medical system. And if you order an imaging service like an X-ray, a CT that's associated with radiation, that could be bad for patients' health too, if it's not going to give us any diagnostic value. So moving forward, I think, it's great to send out these notifications to get patients directly involved in their care, but we have to change the language to a sixth grade reading level so that everyone can have equal access to understanding how they need to move forward with their healthcare. I think we should report metrics so we can standardize, what radiologists are reporting in different areas, so we can make sure that everyone gets the follow-up care that they need. And instead of shifting things to this subjective standard, we should report based on the evidence-proven guidelines so that people only get necessary follow-up care. And that's it.